Good morning, class and Dr. Burden. My name is Crystal Haynes, and I will be introducing you to my future position as a diagnostic medical sonographer. This position will open doors for me to work in 5 different settings. I can choose to work in a hospital, an outpatient clinic, a public health facility, a private practice physician's office, or just a medical and diagnostic laboratory. I looked on Indeed, and there are a lot of companies that are hiring for this position, including Cleveland Clinic, some of the Memorial Hospitals, Cardiovascular Specialists of South Florida, Diagnostic Centers of America, Baptist Outpatient Clinics, and Plantation Hospital as well. A few of the job titles that I can obtain with this degree are ultrasound technologist, echo tech, or medical sonographer. My job description or day-to-day duties will be performing the ultrasound and ensuring that my probe is capturing images correctly. I will be explaining the ultrasound procedure to my patients. I'm in charge of maintaining the ultrasound equipment and also sanitizing the room where the procedure takes place. I will be spreading the ultrasound gel on the surface of the patient's body to cover the internal area that's going to be imaged. I will be evaluating the images for quality and presenting the images and the preliminary findings to physicians and my healthcare team. Lastly, I will be maintaining patient records and adding medical notes related to the ultrasound procedure. My expected entry-level salary is 66 to 70 per year. That is based on the U.S. Bureau of Labor and Statistics. My responsibilities are, after the physician orders the ultrasound for the patient, I will perform the ultrasound study as ordered to determine the medical diagnosis. I will take images of organs, tissues, or the blood flow inside of the body. This industry is definitely growing. Ultrasound techs are really needed in the healthcare field. As the large baby boom population ages, the need to diagnose medical conditions such as blood clots and heart disease, pretty much a lot of the diseases associated with old age, they're likely to increase. Plus, we live in South Florida, which is the retirement state. While completing my degree, I also intend to obtain 2 additional certifications as well before I graduate. They will be from the ARDMS, which is the American Registry for Diagnostic Medical Sonography. One certification will be in abdomen, and the other will be in cardiology. My degree, the name will be the Associate of Science in Diagnostic Medical Sonography. I have to have a total of 77 credits to graduate. The minimum GPA to enter into the program after I complete my general ed is 2.5, but I will maintain an A or B average to have a higher chance of getting accepted into the program. And my anticipated graduation date is December 2022. To qualify for this position, you have to have 960 clinical hours. I am already networking. I have a very, very close friend that is the house manager for Baptist Hospital in Miami, and I did advise her that once I complete the program, I'm very, very open to internships as well as job shadowing for this great position. In addition to her, I do have a church friend who's the manager at the main testing lab for COVID-19 in Sunrise. She does have a medical sonography degree, and I did advise her because she went into the laboratory studies, but she has classmates that graduated and they work at Memorial. I told her that I will be using her for networking and to get a job in this great position as well. From my current research, I did find that Memorial Healthcare System, they do have entry-level job openings that require that certification from the ARDMS, as well as an additional one in basic life support, which I intend on pursuing as well. The last part of my research, I was excited to find out that Broward College offers the Internship Edge program. I will definitely be looking into that once I complete the required hours, and I will be applying for internships through that program through the school. I will be interviewing for Cleveland Clinic That's like my number one hospital that I prefer to work at. So my two questions are, this past summer, I noticed that Cleveland Clinic won the number one hospital in the nation for heart and cardiology surgery again. This will be the third decade that you won this. How has Cleveland Clinic maintained success in this area? My second question would be, what percentage of leadership positions are filled with internal candidates? This concludes my introduction to my future career in medical sonography. Thank you.